Curcumin supplementation linked to 54% reduction in age-related vision loss risk. The study examined almost 2 million patient records and came up with this. This is by Hugh Freeman, Epoch Times. A new study from Stanford University College of Medicine has found that a nutritional supplement derived from turmeric significantly reduces the risk of age-related macular degeneration, AMD, the leading cause of vision loss among Americans. The retrospective cohort study followed nearly 2 million people over 50. It found that people who took curcumin supplements reduced their risk of developing AMD and blindness by more than 50%. I was surprised by the magnitude of the findings and the risk reduction for patients taking CBNS. Study leader and ophthalmologist Dr. Ehsan Rahimi told Epoch Times. Curcumin-based nutritional supplements, CBNS, are infused with curcumin, the active ingredient. Curcumin is derived from the root of Curcuma longa, the scientific name for the turmeric plant. This bright yellow spice, widely used in Indian cuisine, has long been valued in traditional wellness practices. The study's findings were published online Thursday in JAMA Ophthalmology. Macular degeneration affects nearly 20 million Americans and causes approximately 9% of blindness worldwide. The condition damages the retina, resulting in blurred central vision. While the study does not suggest that curcumin can reverse existing damage, it shows promise in preventing disease progression. And although there have been other smaller scale studies on curcumin and macular degeneration, this was the largest to date. The research team analyzed medical records of over 1.8 million patients from 2003 to 2024. More than 66,000 of them had taken curcumin supplements, while the remainder served as a control group. According to the researchers, the study scale and use of human medical records rather than laboratory or animal studies set it apart from previous research in the field. The new research found that patients aged 50 and older with a prescription for CBNS reduced their risk of blindness by more than half, and more specifically, there was a 77% reduction in the risk of dry AMD, a more common, slower progressive form of the disease, and an 89% reduction in advanced dry AMD. The result also showed a 72% reduction in wet AMD, a more severe, rapidly progressing form of the condition. Rahimi, a specialist in retinal diseases, said he became interested in research on this supplement because many of his patients are exploring alternative medicines and supplements to help mitigate the progression of their disease. While research suggests that genetics, age, and smoking play a role in this condition, emerging evidence in recent years has supported that chronic inflammation in the body can also contribute to macular degeneration, formation, and progression, said Rahimi, who has authored numerous book chapters and publications on retinal diseases. Given that curcumin and turmeric are potent anti-inflammatory agents, as well as possessing antioxidant properties, this made it a logical candidate to explore for potential ocular benefits, he said. Our study gives it a scale, helps support some of the existing literature on the topic, Rahimi said, and furthermore, we hope that it will inspire additional investigations into the potential benefits of CBNS. Curcumin has a few adverse effects. Rahimi has not seen data to suggest that curcumin reverses age-related macular degeneration, but he hopes it may be a valuable tool in preventing the progression of the disease. The supplement's safety profile is strong, given its origin as a widely used spice. Turmeric has been used in both food and medicine for over 5,000 years. However, Rahimi notes some important considerations. In rare cases, there's a small risk of liver injury while taking this supplement in higher doses, he said. If anyone is planning to take this as a supplement, they should run it by their doctor to make sure there are not contraindications to use at higher dosages. However, there are some challenges regarding the use of supplement containing curcumin. It has a relatively poor bioavailability in the body due to a low absorption rate, and it's rapidly metabolized and cleared from the body, he said. Certain formulations of the supplement, for example, if paired together with black pepper, can help to significantly enhance the absorption of curcumin from the gut. Consultation with a healthcare provider is recommended before starting supplementation. Curcumin has also been shown to be effective in various other medical applications. There is a precedent to using CBNS in other fields of medicine, for example, to help with joint health and skeletal muscle soreness and recovery, he said. The Stanford team plans to conduct follow-up studies to confirm the findings. Rahimi said, "We're excited by the enthusiasm surrounding this project, and we hope to follow up with additional studies in the future to further verify these findings." And this is from Huey Freeman, Epoch Times on Collective Spark. Please leave your comments, and thank you for your support. Support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.